Good morning, everyone. Today we're reporting 30 new cases of COVID-19 in the state. This does include 5 new hospitalizations and 0 new deaths. We're adding 62 newly recovered individuals to the website, and in total we've had 1,046 new negative tests have been performed. Our totals then for COVID-19 cases in the state are 5,928. Of those, we have 892 active infections, 4,961 recovered individuals, 93 individuals who are currently hospitalized, and 75 deaths. We've had a total of 60,467 persons who have tested negative. Our community impact map, we have no updates today. And for new cases by county, we have 2 in Beadle, 1 in Bennett, 2 in Brookings, 2 in Brown, 1 in Buffalo, 2 in Clark, 1 in Clay, 1 in Davison, 1 in Hutchinson, 1 in Lake, 3 in Lincoln, 1 in Meade, 6 in Minnehaha, and 6 in Pennington. For new cases by age range, we have 2 in the 0 to 19 year age category, 7 in the 20 to 29 year age category, 5 in the 30 to 39 year age category, 6 in the 40 to 49 year, 4 in the 50 to 59 year, 4 in the 60 to 69 year, and 2 in the 70 to 79 year. For new cases by sex, we have 20 that are male and 10 that are female. For the cluster updates, we have a total of 159 of 165 Demcota employees that have recovered, 91 out of 117 Jack Links employees that have recovered, and 41 out of 71 Dakota Provisions employees that have recovered.
In terms of the mass testing for long-term care, this is Kim Alsam-Risden. We have, as of this morning, completed testing for 7,502 residents and 9,680 staff for a total of 17,182. The remaining individuals are scheduled to have mass testing here in the coming days. So far, we have a total of 38 positive residents and 31 positive staff identified through those testing events.
Okay, I'm unmuting our lines, and we'll take your questions.
Beth Warden with Dakota News Now.
Go ahead, Beth.
Yes, what is the process and the criteria to deem that someone has recovered?
So for an individual that is recovered, that is a person who has completed their isolation period, which would be a minimum of 10 days from the time when they first develop symptoms, as well as a minimum of 3 days after they have recovered from and resolved their fever, as well as have a general improvement in other symptoms, such as cough and shortness of breath.
Next question. Any other questions?
Jeremy Fugleberg, Forum News Service.
Go ahead, Jeremy.
Hey, yeah, just wondered about antibody testing. Is that something that the testing that gets done by the health lab or any of the health systems, are those numbers being wrapped into and reported in the state's current totals?
So the antibody tests, because they are detecting something different and mean something different than the viral tests that are currently being done, those are not included in the cases that we're reporting. Those are, as opposed to actually detecting the virus in a person and being able to differentiate whether a person is actively infected, the antibody tests allow a person and clinician to identify whether a person may have been exposed in the past. But it also, again, does not necessarily infer to that an individual is considered immune for any specific time after that, and with detection of those antibodies.
Sure. And is that a number that the state would be interested in posting separately at some point, or is that not up for consideration?
So that is something that we are looking at posting at a future date. Right now, we are in the process of reviewing that data and identifying the best way to release that information. The most appropriate use of antibody tests would be to conduct a paired test series in which if the first test is positive, that it undergoes a second test using a different antibody platform. That's not something that is currently done, and so we're making sure that we're able to appropriately represent the data, and we'll look to push that information out in coming updates on our website.
Okay, thank you.
Next question.
Pioneer.
Go ahead.
With mass testing being conducted, are you still finding about a 10% asymptomatic rate, or has that gone up?
What I would say is overall, it has been a little bit more than 10% individuals who have been asymptomatic. That does fluctuate, depending on whether mass testing is being done, because the majority of those individuals are asymptomatic. Otherwise, they would have been normally tested through other interactions with their healthcare provider. But yeah, we are hovering around that over 10%.
Next question.
Yes, JP from KORN News.
With the Argus Leader.
We'll go to JP first.
Thank you very much. Couple of questions. First of all, is the mass testing of the nursing homes and assisted living facilities completed yet? And if so, when do we move on to the congregate living facilities?
JP, this is Kim Alsam-Reisen. We will be finishing our long-term care testing. We're at 85% of the Tier 3 and about half of the Tier 4, so we anticipate in the coming days that that will be substantially complete with the remainder of the long-term care. And we are already planning on congregate mass testing, and so that will be starting here within the next few days as well.
Thank you.
Next question.
Yeah, this is Trevor Mitchell with the Argus Leader.
Go ahead, Trevor.
Yeah, I was wondering, we're about 2 weeks out from the Sioux Falls protest that some people had concerns that could cause a potential spike in cases. Would we be seeing that around this time if that was something we would see happen?
So, based on the incubation period, we would see where individuals would experience and start to experience symptoms and be seeking care with their medical provider and being tested at around 5 days after any sort of exposure at a gathering, up to about 14 days after that exposure. And so what I would say is that, yes, we would anticipate seeing some of those cases start to roll in.
Okay. I guess, is there any, is the department or anyone looking at cases in that realm specifically as to, I guess, is there being anything to look at whether that causes anything in spikes?
So what I would say is that, yeah, we are always continuing to look at potential exposure risks that may be requiring a public notice. At this time, we've not identified, any specific notice that needs to be issued.
So,
okay,
Trevor,
thank you.
This is Kim Alsam-Reisen.
Oh, sorry, go ahead.
Just during our investigation process, that's a very in-depth process where we look where a positive case may have potentially exposed other people. And so in the event that they were in a public place where there could have been an exposure, we would be issuing those types of notices.
Okay, thank you.
All right. Next question.
Yes, Todd, Apichello.com News.
Go ahead, Todd.
Thank you. The FDA today pulled its approval of the use of hydrochloroquine for the treatment of COVID-19. Considering how fast the Department of Health was to jump on that and for testing and so forth, is there any lessons learned about when politicians suggest the use of drugs and whether they should be used or not or studied?
This is Kim Alsam-Reisen. I just want to clarify a couple of pieces here. The study that the state of South Dakota was looking to be a part of came upon the recommendation of the medical providers at Sanford, Avera, and Monument Health. So it wasn't directed by a politician. The other thing I would tell you, and from a lessons learned perspective, is I think, you know,
Okay,
as
thank
we've
you.
seen
All right,
knowledge and science around COVID and treatment options and what we even know about
Go
the
ahead, Todd.
disease has
Thank you.
evolved since day one. And so we've seen changes in guidance from everything from what a close contact is defined as, to the incubation period, to the recovery period. And certainly we're going to continue to see changes in effective treatments and hopefully vaccines.
Next question.
Yes, Ben Chase with the Plainsman in Huron.
Go ahead, Ben.
I'm just curious with the spike from Dakota Provisions. We have some information that there's been maybe some forced work hours been put in. How would, with employees there, they're reporting this, if they want to come forward, do they come forward to the website there if they don't have access to internet, things like that? How are they to come forward and let the Department of Health know that perhaps they're being forced to work in situations that aren't safe?
So, Ben, for folks that people can email us at the covid.sd.gov website. They can also call the 800 number, and that's another way to get messages to us. And, you know, we're happy to help kind of find the truth in those kinds of things.
Okay, thank you.
We have time for one more question.
Lee Strubinger with SCPB.
Go ahead, Lee.
Thank you. I had seen a Facebook post from a pulmonologist on Friday down in Yankton who was saying they got a call alerting providers that the ICUs in Sioux Falls are filling up quickly with new COVID patients. I was wondering if you could talk maybe a little bit about whether or not that sort of heads up was given, and also how ICUs are distributed.
So, Lee, this is Kim Alson-Reisen. One of the dashboards that we do have on the website is around hospital capacity, which includes overall capacity, ICU capacity, and ventilator capacity, and that's updated on a daily basis. As of this morning, 5% of ICU beds are filled with COVID patients. So I'm not sure what the Facebook post was referencing, but that's been about where we've been at with the need for COVID patients to use ICU beds of the response. It's been a very small number.
Okay, thank you.
You're welcome.